Baldness is known as a pattern of hair loss in males and females without growing new hair from lost hair follicles, and some baldness is a natural appearance of aging, but it is a source of distress and inconvenience for many, especially women. Each hair consists of a bulb under the surface of the skin. The shaft of the hair is the visible part for us. The bulb is the living part that grows and divides, surrounded by blood vessels and greasy glands to feed. And we lose our hair when we lose the hair follicles. It should also be noted that hair in normal is falling out daily. We lose about 5,100 hair a day. And you can see it on the pillows, in the bathroom, and everywhere. Hair follicles produce substitute hair loss due to the fact that the hair loss process and its production are continuous and balanced. But the disruption of this process and the inability of the follicles to compensate for hair loss is the main cause of baldness. There are many patterns of baldness, including genetic baldness, female baldness, macular baldness, cardiac hair loss. Genes or genetic factors are among the most common causes of baldness, especially male or genetic baldness, inherited by the individual from his or her parents, and are more common in males, where hair becomes thinner, shorter, its growth takes longer than usual, and poetic experiments gradually shrink, and hair does not grow at all. The main causes of baldness include hormonal disorders. Baldness in women may appear in a pattern similar to male baldness, which may be a signal of a hormonal disorder. Autoimmune diseases. An individual develops macular alopecia that causes hair loss. Macular alopecia is considered an autoimmune disease. Some other autoimmune types may also cause hair loss and baldness, such as lupus or syphilis. Some diseases, such as anemia or a thyroid problem, side effects of certain drugs. The use of certain drugs may lead to baldness, such as chemotherapy, blood thinners, high doses of vitamin A, epilepsy medications, hormonal medication treatment, some anti-stressors, and steroids taken by some men to help build muscle. Skin infections in the scalp. Scalp infections can lead to hair loss, nutritional deficiency and malnutrition, iron deficiency, vitamin A deficiency, protein deficiency, or zinc deficiency can cause hair loss. Psychological stress. Poor psychological condition is one of the most famous factors causing hair loss. Baldness caused by hair tightening and laying off with sternae, such as ponytail or tight braids for many years. Symptoms of baldness and hair loss. Hair weakness in the front of the head. Baldness symptoms in men start with hair loss from the front of the head, often in the form of an N, and then retreat back until the hair is thinner, while in women hair usually stays at the front of the head, and starts to fall from the top of the head to the middle of the head to the middle of the head. Bald circular patches. Individuals may experience circular hair-free patches, and are usually in the scalp as they may appear on beards or eyebrows. How to prevent baldness and hair loss? Eat a balanced diet, stay away from stress triggers, avoid tightening the hair during its styling, and avoid layering it in the way of tight braids, cakes, and ponytails. Treat your hair gently during the shower. Straight your hair gently during the shower. Stop using any drugs that cause hair loss after consulting a doctor. Do not share hair care towels to avoid hair loss resulting from fungi. Avoid the use of hot rollers, hot oil. Treatment of baldness and hair loss. Pharmacotherapy. There are many medications to treat baldness, including the following: minoxidil. Minoxidil is a drug used to treat hair loss, found in pharmacies in the form of ointments or shampoos, and is used topically. It should be noted that it is a drug that lowers blood pressure when taken in the form of oral tablets. Finasteride. The drug finasteride helps reduce baldness and hair loss, also improves hair growth, but being anti-male hormones, it can cause male sexual impairment, making its use undesirable. It can also cause signs of femininity and increase the risk of prostate cancer, so women are advised not to use it, and scalp infections should be treated if any. Hair transplant. Hair transplantation is a technique that uses surgery to treat hair loss or baldness. Hair is rooted by removing a patch of skin containing hair. cultivated in another hairless area. The patch is usually taken from the back of the head to the front scalp. It should be noted that surgical procedures for the treatment of baldness are expensive and may be painful. The likelihood of infection. Laser therapy. Baldness can be treated with low-level lasers. Lasers are treatments that use light or heat therapy. They stimulate hair growth in women and men, and specialists assume that they stimulate stem cells in the scalp. Natural remedies. There are many natural remedies that help in hair growth and reduce hair loss, including a balanced diet. People with hair loss should follow a balanced diet, as should adequate protein intake, care to eat vegetables, seeds, nuts, green leafy vegetables, fresh fruits, eggs, milk, yogurt, soybeans, cheese, and milk, but eating supplements has not proven useful. Scalp massage. A scalp massage procedure may help activate circulation of blood and sebaceous glands in the scalp and make hair growth healthy. Use some types of oils. Some natural oils, such as coconut oil, mustard oil, or castor oil, can be used in the treatment of hair loss.